Charlotte, thank you so much. Yeah, it's quite important to talk about my cat, but it's more important being here. I'm really honored to be part of this ITR World Symposium today. And I want to talk about surgical outcomes. Think about you have a patient in your practice, in your university, looking like this. Look at the maxilla, and now the patient wants something to chew on. What do you want to give him? Like overdentures, you think about implants. We have, this is the reconstruction from the CBCT, and you see there's no bone at all. So in this patient, what did we do? Well, we got some bone from the iliac crest, and we did, let's say, an old-fashioned augmentation. You just look through my GoPro camera now, and you see you can harvest quite a big amount of bone, and we did the augmentation as it should be. So normally we expect our patients to be back, let's say, 4 months after augmentation, but in this case we had a severe problem. So the problem was the patient, she did not come back at all. So what were the issues? She had personal issues, we found out. She had progressive dementia, and she did not want to pay for implants. So you have a case in which you did augmentation, but you cannot place the implant. Poor patient. So she came back actually 1.5 years after grafting. And we know the problems of iliac grafts when there's no implant therapy. We have a severe resorption, as stated here in this study of an overview of onlay graft resorption.